We all really want to help our patients sleep better and feel better. It's frustrating when we know we've done our best and they still come back complaining that they're fatigued or they can't sleep. The lecture I'll be giving is an introduction to some new ideas that will give you so much more success with your patients. There's some new discoveries in the field of brain science related to how our sleep has evolved in connection with our planetary cycles. You know about one of those cycles already, the circadian cycle. Light entering the eye using retinoids like vitamin A entrains our sleep to a 24-hour day-night cycle. There's a second cycle, and surprisingly, we are also linked to that cycle by sunlight. It's the annual winter-summer cycle. Sunlight entering the skin makes vitamin D, which allows us to sleep longer in the winter and shorter in the summer. And the vitamin D that we make, we share with our intestinal bacteria. They, in turn, allow us to gain weight in the winter and lose weight in the summer. Unfortunately, avoidance of the sun and the use of sunscreen has resulted in a global deficiency of vitamin D that has brought with it the unintended consequences of horrible sleep and the wrong belly bacteria, both of which are now clearly shown to have to do with our failing health. There is some good news, though. Once we recognize that there are vitamin deficiencies in the background that have been overlooked, that have nothing to do with nutrition, we can learn how to add these building blocks back, giving the brain what it needs to sleep normally and giving the belly bacteria what they need to return to normal. Right Sleep is a protocol that's been in use for more than 10 years. It's helped over 6,000 patients sleep better and feel better. Come and learn how to use Right Sleep in your practice, improve your patient outcomes. You can add it to any treatment protocol you're using now, and your patients will come back saying, I'm sleeping better than I have in 25 years.